At MediBank, we are creating India's first centralized EHR system. People often confuse this with an EMR. We have a lot of EMRs, but EMRs are primarily used in a clinic or a hospital environment, whereas an EHR combines both a patient perspective of it and the clinic perspective of it and centralizes the whole data. So that's what we are creating. Most of the OECD nations have this feature, and with the amount of technology advancements happening in India, we thought it's the right time to create a centralized system for India. The reason to create this actually came from a personal experience. So 2 years ago, when I moved to India from Australia and I had to take my parents to hospitals, every time I was carrying a bunch of folders and bags with all reports in them, even though we're going to the same hospital and my parents have been going there for the last 5-6 years, from what they've mentioned, they have no record of whatever treatment they have done. We had to carry the records with us, otherwise there's no other recourse. So that's where the idea came up. We found that there's a gap in the market. We did an extensive research for over a year, on-ground research, talking to a lot of doctors, hospital administrators, users and patients that would end up using this. And then we started development last year to create a platform that's useful for everyone. So the way it stands out is, one, it's user-friendly. Two, as I mentioned, it's one single platform for both doctors and patients. Instead of patients, we want to call them users, because for the first time in India, what we are creating would provide you a facility where you can start storing all your records or access all your records in one place right from birth until your death. That's the unique service proposition that we have, accessibility. And for the first time, patients or users will have access to their own health data. Up until now, the data used to be in pen and papers, folders, or in hospital systems. Now users will have access to it for the first time. The biggest challenge is, the inertia we need to of a cultural mindset that normally is in India. Because India is a diverse country, what works in Delhi may not work in Chennai, let's say as an example. So we had to be very careful with the cultural differences, the diversity, and also the linguistic differences and the mindset of the healthcare professionals, the healthcare ecosystem, as well as the patients. So building a beautiful UI or a well-built product is not good enough in an environment or a market like India. It has to be something which actually helps them, adds value to what we have. So the challenge for us was convincing everyone and making them understand that this is not some other system where you pay for it. It's not a software. It's something that adds value to what you do. AI is a long-term, let's say, project in what we are building. Initially, we don't want to come out with buzzwords like AI and all, because we need the data to come through for AI to work effectively. That's what we are trying to build here. We are trying to build an ecosystem where the research and development in India happens based on the Indian patient's data or in the Indian consumer data. So the long-term goal that we have is, once we start collecting this data, our inbuilt AI system will start working them, analyzing them, giving proactive information to both users that there may be an issue with their health to go and visit a doctor, or when they visit a doctor, it gives a pre-population to the doctor so they can provide better care for them of any risks that the AI identifies based on the reports a user uploads or the system is able to pull up. We want MediBank to be the de facto system for the whole health for EHR options in India, or we want us to be the baseline protocol of how an EHR should operate. We are not saying that we will be the only one in India, but we are more than happy to work with anyone that are willing to create this ecosystem, because this is, for us, it's more about bringing a social change and an ecosystem change more than building a business where we are effectively trying to make money. So as part of that, we are creating rules which meet international standards, which fulfill international security protocols, but at the same time are easy to operate, easy to manage, easily accessible to everyone, including users and the healthcare ecosystem equally.